that we have two systems of circulation, pulmonary and systemic circulation or large circulation. Pulmonary circulation starts from right ventricle with the help of pulmonary trunk. Pulmonary trunk subdivides into two pulmonary arteries. They conduct deoxygenated blood to lungs, and from lungs, oxygenated blood through pulmonary veins. How many pulmonary veins? Four pulmonary veins comes to the left atrium. That is end of pulmonary circulation. And systemic circulation starts from left ventricle with the help of aorta and finish in right atrium, where superior and inferior vena cava inflow. Now, from left ventricle start aorta, and aorta consists of ascendance part, then arc of aorta, and descendance part of aorta. Beginning of aorta, that is bulbous aorta, and here it is we have two coronary vessels, arteria coronaria dextra and arteria coronaria sinistra. From arcus aorta start brachiocephalic trunk, left common carotid, and left subclavian artery. And from brachiocephalic trunk start right common carotid and right subclavian artery. Common carotid artery, first of all, it passes through trigonum caroticum, and here it is we can press common carotid artery in time of bleeding on the neck or on the head, where we press this common carotid artery if we need to stop bleeding. Do you remember what is the level where we can C6? Yes, that is level of cricoid cartilage on the neck. Cartilaga cricoidea, it corresponds to the level of C6. And if you remember, what is the name of anterior tubercle of the sixth cervical vertebra? Tuberculum caroticum, yes. And we can press common carotid artery to this tubercle and stop bleeding on the face, on the neck. And common carotid artery subdivides into internal and external carotid artery. Next time you will prepare only external carotid, external. External carotid artery has three groups of branches, and each group consists of three arteries. For example, anterior group. In anterior group we have arteria thyroidea superior, superior thyroid artery. It goes to thyroid gland, and the same it gives superior laryngeal artery, arteria laryngea superior, which goes to larynx. Clear. Next branch, anterior branch, that is lingual artery, arteria lingualis, and lingual artery pass through Pyragov's triangle or lingual triangle. Do you remember what is superior wall of lingual triangle? That is nervus hypoglossus. Anterior wall musculus miliaceus, and posterior wall venter posterior of musculus digastricus. And last anterior branch, that is facial artery, arteria facialis, and continuation of facial artery, that is arteria angularis. It goes to angle of eye and makes anastomosis with dorsal artery of the nose, arteria dorsalis nasi, from ophthalmic artery. That is why terminal branch of facial artery, that is arteria angularis. Three anterior branches, superior thyroid, lingual, and facial. Next, three posterior branches, 1, 2, 3. First and largest posterior branch, that is occipital artery, arteria occipitalis, goes to occipital region. Give me base of the skull. If you remember, here it is sulcus arteria occipitalis, an occipital artery pass to occipital region, supplies occipital region with blood, and gives branch to foramen mastoideum, and supplies dura mater in posterior cranial fossa. that is occipital artery. Next artery, that is arteria sternocleidomastoidea. This artery supplies corresponding muscle, musculus sternocleidomastoidus. And last artery in posterior group, that is arteria auricularis posterior, goes to ear. 3 posterior branches and 3 arteries in middle group. They are arteria pharyngea ascendens. Pharyngea ascendens. It passes in space between external and internal carotid artery and supplies pharynx. And 2 terminal branches of external carotid. They are arteria temporalis superficialis. It passes in front of external acoustic meatus and subdivides into frontal branch, ramus frontalis and ramus parietalis. And the last branch, that is arteria maxillaris. Arteria maxillaris. Arteria maxillaris has 3 departments. First department behind of neck of the mandible, knee of neck of the mandible. Second department in fossa infratemporalis. Here it is, fossa infratemporalis. And last department in fossa pterygopalatina, in pterygopalatine fossa. In first department, knee of the neck of the mandible, from maxillary artery start arteria meningea media. This artery passes through foramen spinosum and supplies dura mater in medial cranial fossa, meningea media, and arteria alveolaris inferior. It goes to the mandible, supplies teeth and gingiva, and continues as arteria mentalis in the skin of the chin. In the skin of the chin, here it is. In the second department, in fossa infratemporalis, we have arteria alveolaris superior posterior, arteria buccalis to buccinator muscle, and arteria pterygoidea goes to both pterygoid muscles. And in last department, in pterygopalatine fossa, we have arteria infraorbitalis. Arteria infraorbitalis pass into the orbiter, continues into the same canal, canalis infraorbitalis, leaves this canal through foramen infraorbitalis and makes anastomosis, here it is, with facial artery. And in time when infraorbital artery passes through the same canal, it gives arteria alveolaris superior anterior to anterior teeth. The same arteria maxillaris gives arteria sphenopalatina, it goes to nasal cavity, and palatine artery, which goes to hard and soft palate. They are branches of arteria maxillaris. Please give me your manual. Have you got? Not necessary to draw next time. All of these arteries only for your understanding. Pulmonary or lesser circulation, page 259, aorta, aortic arc, brachiocephalic trunk, and external carotid artery. External carotid artery and branches of maxillary artery you can see on this diagram. For example, that is tympanica superior, the same. We have 2 tympanic cavity. Temporalis profunda goes to temporal muscle. Sphenopalatina, arteria infraorbitalis, palatina descendens, then buccalis, pterygoidea, arteria masseterica, the same. Rami dentalis, rami mentalis from arteria alveolaris inferior. All of them present in this diagram. Have you got any questions?